Hi everyone. Today we are talking about how we would find out that we have heart failure. How would you know? And last time we talked about the symptoms that you might present with, and predominantly there was things like shortness of breath, but also evidence that you're holding water in your tissues, like swelling of the ankles or feet or legs or right up to the belly, and things like that. So I won't go over all those again because we did that last time, but now we're at that point where you go, okay, right, I might have heart failure. What do I do next? So the next thing you do is you go see your family doctor. If this is not an urgent situation, call an ambulance, go to hospital, and you'll get really, really sorted out. But not urgent, go see your family doctor. Tell your doctor very specifically about the difficulties you're having with your breathing, especially. Are you wheezing? Are you short of breath when you lie down in your bed? Are you waking up in the middle of in the middle of the night, short of breath? Things like that. Can you no longer fit in your shoes? Are your socks leaving marks at your ankles? You're huffing and puffing? Are you getting more fatigued doing any exertion? Is the amount of exertion you could do dropping? So yeah, that's a little bit of a recount of what we did. But you've got these problems, right? So you go next to your family doctor and you tell your family doctor in as much detail as you can about those things, so that your doctor has a good idea of what's been happening to you and over what time period this has been occurring. So those things are important. The doctor is then going to have a look at you and clinically examine you, and they're going to look for things like raised veins in your neck that are standing out. They're going to listen to your heart to see if there's any sort of problems with the heart sounds, the heart valves, and they're going to have a listen to your lungs, and then listen for noises in your lungs, particularly wheeze or crackles. They're trying to find evidence that you have fluid retained. They might be feeling where your heart is and seeing if it's sort of moved over a bit, seems to be not quite in the right position. And then they'll look at your tummy and legs, maybe feel your tummy, look at your legs, might even press on your ankle or on the side of your shin and look for physical marks left behind by that pressure in your tissues. And if that's the case, then you are holding water, and they might look for the level at which that comes up the leg, in fact, to see how severe it is. And probably you'll need to know your weight, maybe what your weight was before all this happened, and certainly your weight right now. So hopefully they'll weigh you as well, because this will tell us potentially how much water weight or fluid weight you're holding, and we'll talk about that later on. But after looking at you and seeing if they think, yes, maybe you do have some clinical heart failure, the next thing to do might just be to do a 12-lead ECG. That's where they lie you down on a bed and they'll put these little sticky dot plasters over you, certain parts over your chest and arms or hips, hands, legs. And then they're going to look at the electricity conducting from through your heart, see if there's anything that looks out of place there. They may do a chest x-ray, and they might also do a blood test. So the chest x-ray, they're looking for signs of enlargement of the heart, they're looking for fluid in the lungs or even around the lungs in the what we call the pleural spaces. So this is the lung tissue. The organ of the lungs is held in the cavity of the chest, but between the chest and the lungs is this fine lining, and there should be nothing in that space, a very, very fine film that separates the two linings. What happens in some people in heart failure is that the fluid fills up between those spaces, and particularly at the bottom where the diaphragm is, and you hold fluid, and we call that a pleural effusion. It's water that's filling the lung spaces. It shouldn't be there. And that's a possible sign of heart failure too. So A chest x-ray might be helpful in that regard. Then in blood tests, they'll look at your kidney function and a bunch of other things. Are you anemic? But they may do a special test called an NT-proBNP, or different BNP assays done in different labs, but they're basically called a brain natriuretic peptide. This is a possibly diagnostic test to see if you have heart failure. It's just taken by a blood sample, fairly readily available, and can give us more of an indication if you might actually have heart failure. The next important test is what we call an echocardiogram. This is really important because this is an ultrasound of your heart. Now, if your chest x-ray says that you've got an enlarged heart, that could be quite a scary thing to hear. But bear in mind that sometimes the x-rays, because of the projection of the way that the x-ray is taken, can physically potentially overestimate the size of your heart. A CAT scan might also do this and call something enlarged that maybe isn't. The very best way to measure if a heart is actually enlarged or not is this form of ultrasound called an echocardiogram. So the echocardiogram, which takes around about 30 minutes for a good study, maybe a little longer if necessary, done by a person who's very skilled in this type of ultrasound, is going to measure the size of your heart, the chamber sizes in your heart, have a look at how the heart is pumping, have a look at the valves and whether they're leaking or getting blocked. And so we can tell a lot from that ultrasound. And the ultrasound can help us diagnose if you have heart failure. And there are lots of causes of this, as we've discussed before, but the ultrasound helps us understand what possible cause you might have. There might be need for other tests once that's done. If you have a history or risks for coronary disease, artery blockages, then you might need stress testing, or you might need an angiogram. And these are more specific tests to look at the artery structure and function to supply the heart muscle itself, and see if you've got evidence of blockages that need to be corrected that might be causing the pump to fail. So the echocardiogram is a must in order to determine if you might actually have a clinical diagnosis of heart failure. And once we have that diagnosis of heart failure, what is it you do next? Well, we're going to find that out in the next video.